Obsessive Compulsive Disorder, OCD, is a mental health condition that is characterized by unwanted, intrusive thoughts or images, obsessions, and repetitive behaviors or mental acts, compulsions, that a person feels compelled to perform in response to these obsessions. OCD is a common and debilitating condition that affects millions of people worldwide and can have a significant impact on a person's ability to lead a normal life. The obsessions experienced by people with OCD can be distressing and anxiety-provoking, and they can take many different forms. Common obsessions include fears of contamination or germs, unwanted sexual or violent thoughts, worries about symmetry or order, and the need to repeatedly check things such as locks or appliances. These thoughts can be intrusive and difficult to ignore, and people with OCD may feel compelled to perform repetitive behaviors or mental acts in order to reduce their anxiety and prevent harm to themselves or others. The compulsions that people with OCD engage in can also take many different forms, including repeated hand washing, counting or checking, ordering and arranging, and mental rituals such as repeating words or phrases. These compulsions can be time-consuming and interfere with a person's ability to carry out normal activities and responsibilities. The exact causes of OCD are not fully understood, but research suggests that a combination of genetic, neurological, and environmental factors may play a role. For example, imaging studies have shown that people with OCD have differences in the structure and function of certain brain regions that are involved in regulating thoughts and behaviors, and there is also evidence to suggest that stress, trauma, and life events can trigger or worsen symptoms of OCD. Body dysmorphic disorder, BDD, hoarding disorder, trichotillomania, and excoriation disorder are all different mental health conditions that fall under obsessive compulsive disorder category, each with its own specific symptoms and characteristics. Body dysmorphic disorder, BDD, is a condition in which a person is excessively concerned with perceived flaws or defects in their appearance that are either minor or not noticeable to others. People with BDD may spend hours checking their appearance, comparing themselves to others, or seeking cosmetic procedures to try and fix their perceived flaws. Hoarding disorder is characterized by the persistent difficulty discarding or parting with possessions, regardless of their actual value, due to a perceived need to save them and to the distress that discarding them would cause. People with hoarding disorder may accumulate so many items that their living spaces become cluttered, making it difficult to move around or use their space as intended. Trichotillomania is a condition in which a person repeatedly pulls out their own hair, causing noticeable hair loss and bald patches. This behavior can be difficult to control and may result in physical and emotional distress. Excoriation disorder, also known as skin picking disorder, is a condition in which a person repeatedly picks at their skin, causing damage and leaving behind scars. People with excoriation disorder may feel compelled to pick at their skin in response to various triggers, such as stress, boredom, or the presence of an perceived skin imperfection. It's important to note that these conditions can have a significant impact on a person's quality of life and may interfere with daily functioning, relationships, and overall well-being. If you or someone you know is experiencing symptoms of any of these conditions, it is recommended that you seek help from a mental health professional. Treatment for OCD typically involves a combination of medication and psychotherapy. Antidepressant medications, such as selective serotonin reuptake inhibitors, SSRIs, have been shown to be effective in reducing the symptoms of OCD, and cognitive behavioral therapy, CBT, can also help people with OCD to learn new strategies for managing their obsessions and compulsions. In CBT, people with OCD work with a therapist to challenge and reframe their thoughts, and to gradually expose themselves to situations that trigger their obsessions and compulsions in a controlled and safe way. Despite the availability of effective treatments, many people with OCD experience significant barriers to getting the help they need. These can include stigma, lack of awareness, limited access to mental health services, and financial constraints. Additionally, Many people with OCD experience a range of co-occurring mental health conditions, such as depression, anxiety, and body dysmorphic disorder, which can make their symptoms even more challenging to manage. OCD is a common and debilitating mental health condition that affects millions of people worldwide. Despite advances in medical research and the availability of effective treatments, many people with OCD still face significant barriers to getting the help they need, and more work is needed to improve access to care and support for people with OCD. With the right treatment and support, however, people with OCD can learn to manage their symptoms and live fulfilling and productive lives.